to Castle Rock Adventist Hospital. We are honored to be a part of welcoming your baby. My name is Chelsea and I am your birth concierge. I help you to navigate through your birth experience and I help communicate with your nurses so that they understand your wishes during labor and after delivery. We will walk through a virtual tour of our facility and discuss what to expect from admission to discharge. When you have decided to or are trying to decide if you are heading to the hospital, call your OB or midwife office. Even after hours, call their main phone number, listen to the menu options, and choose the option that allows you to speak with their on-call provider. When you speak with them, they will notify us at the hospital so that we are prepared for you when you arrive. Scheduled inductions or C-sections do not need to call if they are coming at their scheduled date and time. To check in, all patients, whether you are scheduled to be here for an induction or C-section, are here for a labor check, or are in labor, park by the emergency room entrance off Limelight Avenue. This is on the east side of the hospital and is marked well with red signs. Enter the hospital through the emergency room entrance. The receptionist at the emergency reception desk will get you signed in. They will typically ask if you want a wheelchair ride to labor and delivery or if you prefer to walk to the elevators and go to the third floor independently. You can determine what you prefer when you arrive. When you exit the elevator onto the third floor, you will be in the waiting area. Our labor and postpartum units are secured with locked doors, both when entering and exiting the units. We take extra precautions to keep your baby safe. This includes 2 different types of security bands. Visitors may come from 8 a.m. until 8 p.m. We do have a quiet time from 2 to 4 p.m. daily. You are not limited on number of guests, but keep in mind, while you are here, it is important to maximize your rest and bonding time with baby, and the rooms comfortably seat 2 to 3 extra people. Our department is made up of 2 separate units, labor and delivery and postpartum. Our postpartum unit opened in August of 2022. Mom will labor and deliver baby on the labor and delivery unit. If we fill up, mom will be transferred to the postpartum unit after delivery. Skin-to-skin time will still be a priority, so we do like to delay moving mom to the postpartum unit for at least an hour or 2 after delivery so that she can enjoy those snuggles and a golden hour with baby. On the labor and delivery unit, we have 13 labor rooms. 4 of them are more standard size labor rooms and the other 9 are larger. Of those 13 rooms, 7 have soaking tubs with a shower head and 6 have walk-in showers. All types of rooms are given out on a first-come, first-served basis. If you have completed your birth concierge worksheet and returned it to me, you are given the opportunity to express your preference in room type by circling whether you prefer a tub or a shower room. Please keep in mind, the tub is used as a labor comfort measure. We do not do tub deliveries here at Castle Rock Adventist. Let's review comfort measures for laboring moms. We provide labor balls, so you do not need to bring one from home. There will be a peanut ball, squat bar, birth stool, and a heating pad that can also function as a cooling pad. The tub or shower, depending on which type of room you are in, can be used for comfort during labor as well. If you are interested in music, aromatherapy, or artificial candles, these are things you are welcome to bring with you from home to use as tools. If you have done any labor training, you may also have prepared yourself and your support person for massage, visualization and imagery, relaxation and breathing techniques, and walking and changing positions. Nitrous oxide, IV pain medication, and an epidural are all medication options for labor. Keep in mind, nitrous is not a pain medication. Your labor nurses will be there to help guide you and make suggestions if you would like. We have an anesthesiologist in-house 24/7. If you wish to have nitrous or an epidural, anesthesia will provide these and review a consent form with you. There is also a DEC OB in-house 24/7 in case a patient's OB or midwife is needed and not available at that time. This is a specialized labor bed, which can be adjusted to help with labor positions and for delivery. When your baby is born, it is our normal practice to put them up on your chest, skin to skin right away. The nurse will come dry them off, place a hat on them, listen to their heart and lungs, and assign the APGAR score. If baby is doing well, they normally stay skin to skin. If their assessment shows that they need oxygen, suction, or heat, those things can normally be provided in the room at the warmer. Baby does not typically leave the room unless there is a medical necessity after delivery. Our providers normally delay cord clamping for at least 1 minute and ask the support person if they would like to cut the cord. Please direct any other questions regarding cord clamping to your OB or midwife. Your baby will soon be ready for their first feeding. Whether you choose to breast or bottle feed your baby, the nurses are here to help you and provide support. So please ask them if you have questions. You will also receive more information in the hospital regarding our lactation support group as well as lactation specialist availability. Within an hour or two after a vaginal delivery, mommy's bladder is likely full and it is time to get up to the bathroom for the first time. Even after an epidural, at this time, mom can usually walk with assistance. We provide the supplies for perineal care, including the mesh underwear, pads, perineal bottle, witch hazel tux pads, lidocaine spray, and ice packs. You will take home any remaining perineal supplies, but you may want to purchase extra pads and witch hazel to have at home. After you are up to the bathroom for the first time, you will be transferred to the postpartum unit to snuggle up with your baby for the next day or two until you are discharged from the hospital. There will be a fold-down or pull-out couch in the room for your support person. We provide blankets, sheets, and pillows for them throughout their stay. By request, we can also provide them with towels and washcloths if they need to shower. If mom has a C-section, planned or unplanned, she will be taken to the operating room. If general anesthesia must be used, which is very rare, mom will not be awake for surgery and the support person must wait in the patient room during surgery. If a spinal anesthesia is placed successfully, mom will be awake for surgery and one support person is allowed to join her in the operating room. After anesthesia is placed, a nurse will bring the support person to sit at the head of the operating table. Cord clamping is usually still delayed, then the neonatal nurse practitioner will show you your baby and baby will get dried off really quick on the warmer. There is a screen for you to see your infant on the warmer while they are being dried off. We still provide mom with skin-to-skin time as soon as possible, and under normal circumstances, she, the support person, and baby do stay together in the operating room for the remainder of the surgery. After surgery, mom is moved to her room for recovery, where the nurse will be with her at the bedside for 1 to 2 hours. Again, mom may be moved to the postpartum unit or she may stay in this room, depending on how many incoming moms we have. The post-operative C-section rooms are the same style and size on both units. Breastfeeding will still be a priority in the recovery room. When mom is able, a nurse will then help her to stand at the bedside and eventually she will walk in the room and then in the halls. For all babies, whether born by C-section or vaginal delivery, within the first 1 to 2 hours after birth, usually after the golden hour of skin-to-skin time, the nurses will check baby's weight and measurements, perform a head-to-toe assessment, and give newborn medications. The American Academy of Pediatrics recommends administration of vitamin K, the hepatitis B vaccine, and erythromycin eye ointment after delivery for all newborns. Please call your pediatrician if you have any questions or concerns regarding these medications. You will need to sign a consent or declination form for the hepatitis B vaccine once you are in the hospital, and you will also need to sign a form if you plan to decline any other medications or standard procedures. The nurses are here to help, so please ask if you would like any education regarding swaddling, diapering, soothing, or anything else. You will have a crib in the room for your baby. In the crib drawers, you will find baby care items such as diapers, wipes, blankets, burp cloths, t-shirts, and bath supplies. When packing for baby, remember a blanket, a couple cute outfits for photos, and for going home, and your car seat, which you can have safety checked at a Castle Rock or local fire department. When having a fire department check your car seat, please make sure you have it installed to the best of your ability and have the car manual and car seat manual with you. Sleep safety is very important. If you are sleeping, baby must be in the crib and not in the bed with you. If you are walking with baby in the hall, they must also be pushed in the crib. Always put your baby on their back to sleep. We follow the family-centered care model. This means that your baby does stay in the room with you. We do not have a nursery for them to go to at night. If you are having a C-section, it is especially important to have a support person stay that first night with you if at all possible. There are a few newborn procedures to expect while you are here. We are happy to bathe your baby if you wish. We do routinely delay bathing to give baby some time to adjust to life outside the womb. If you choose to have baby bathed, this will be done in the room under a radiant warmer, and you are welcome to participate. A technician will also come to your room to perform a hearing screen. This is normally done around 12 to 24 hours after delivery, but can vary. Newborn labs are checked around 24 hours after delivery and are typically done at the bedside as well. This includes a heel prick for a blood draw to check a bilirubin level and newborn screen. The bilirubin results will be back within an hour or so, and the newborn screen is sent off to the state for resulting. Baby will also have the oxygen on their hand and foot checked for a heart screening. The umbilical cord clamp will normally be removed as well. Baby will not be discharged until these results are back and the pediatrician has written a discharge order. You must have designated the pediatrician who you plan to follow up with prior to the 24-hour labs being drawn and prior to discharge from the hospital. If you have a boy, you will need to decide if you want him circumcised. This requires a consent to be signed by a parent. Circumcision is usually done after he has voided once in life and is 24 hours old or more. He also must have received his vitamin K injection at delivery. A local anesthetic will be used and he will be offered a pacifier with sucrose water drops to help with pain relief. Circumcision is done in the nursery, usually takes around 20 to 30 minutes, and a parent is welcome to ask if they would like to join baby for the procedure. Make sure you have petroleum jelly at home for aftercare. The nurses will review this with you in the hospital. A Bella baby photographer will make rounds to offer newborn photos, usually the day after delivery. Feel free to bring any outfits or items that you may want included in these photos. The photo session and editing does not cost you anything. You will be given information for an online gallery if you wish to purchase any photos or packages. We have a 4-bed neonatal intensive care unit. There is a neonatal nurse practitioner in-house 24/7 for any questions or concerns regarding baby. A mother can usually have her baby here once she is 32 weeks along in her pregnancy. It is very important to check in with your OB if you think you are in early labor. If you are having complications with your pregnancy or expecting your baby to be admitted to the NICU, we can discuss this further during our consultation. For meals, mom can order breakfast, lunch, and dinner through room service as part of her hospital stay. Room service hours are from 7 a.m. to 7 p.m. The patient will call room service to order a la carte from the menu. As a special gift, Labor and Delivery pays for 4 additional meal coupons for the support person. Each coupon covers a room service tray or up to $10 in food and drink from the Manna restaurant. You can pay cash, check, or credit card for any additional meals your support people or visitors would like to order through room service or at the restaurant. You are also welcome to bring food from outside of the hospital. You will have access to the nourishment room throughout your stay. In this room, there is a refrigerator that the hospital has stocked up with snacks for you to help yourself to. Please do not put any of your personal food in this refrigerator. It will be discarded. You will have a mini fridge in your room to store your personal food in. In the nourishment room, there is an ice and water machine, coffee, a microwave, and drawers and cabinets stocked with other snacks. In this room, you will also find carts. Upon discharge, if you find that you have accumulated a few loads worth of items to take to the car, your support person is welcome to use a cart to help them pack the car up. For pain relief throughout your stay, most medication is ordered as needed. This means if you are in labor or if you have had your baby and desire medication, it is your responsibility to call your nurse and ask for it. There will be a medication education sheet in your room. We will establish a pain goal with you on a scale of 1 to 10. For discomfort both during labor and after baby is born, everyone's tolerance is a bit different, so we would like to establish at what point you would normally like to take medication. We will start with medications such as acetaminophen and ibuprofen. Narcotics are not used routinely unless pain is severe and not well controlled with non-narcotics. If you desire pain medication, push your nurse call button and ask for it. We also provide prenatal vitamins and stool softeners, so you do not need to bring your own from home. A normal stay is 1 to 2 nights after a vaginal delivery and 3 to 4 nights after a C-section. This may vary if medically necessary for mom or baby. Your OB and your pediatrician will need to write the discharge orders for you. Once nurses receive orders, they will confirm that you have watched your discharge video during your stay, prepare your discharge paperwork, and review your discharge paperwork with you. When exiting the hospital, they will stop at Manna to get you your pizza that I mentioned earlier. Now that you have reviewed what to expect, you can email me with any questions or concerns, and for your birth concierge paperwork, which is a great tool to help your nurses to know all about your birth preferences ahead of time. We are so excited to share your birth experience with you.